Perfect. So tonight we're going to be talking about rhinoplasty, what people want. This is Dr. Porter. She has been in practice for over 25 years now. She is a double board certified facial plastic surgeon. So she specializes in otolaryngology and facial plastic surgery. Rhinoplasty is her specialty. That's the number one surgery that she performs. She has also published multiple book chapters and articles on rhinoplasty itself, and in particular, ethnic rhinoplasty. She's also been invited as a guest speaker, and she definitely goes for more of natural and balanced results. She's also been voted a top doctor as well as best cosmetic surgeon in Bethesda magazine. So she is definitely the one that you want to be doing a rhinoplasty if you are thinking about it. So tonight she'll be talking a little bit more about rhinoplasty.
All right. Thank you, Kelly and Catherine, for getting the polls going and everything and welcoming everybody. And I just wanted to welcome everybody again. And we're just going to go through some information about rhinoplasty so that people will have a general idea of what we do here at Chevy Chase Facial Plastic Surgery. So I'll talk a little bit about what rhinoplasty means, what some of the common concerns are that people have, some of the findings and factors that make me decide one way or another what type of surgery needs to be done. We'll go over the consultation process, what the preoperative visit entails, the surgical day and what that looks like, the postoperative care, and what the general outcomes can be. And so rhinoplasty comes from two words that are Greek in origin, rhinos, which is nose, and plastian, to shape. And it's really changing the outward appearance of the nose to go from a nose that has, a hump and some droopiness to a nose that has just nice, clean lines and just looks like a nose. And what are some of the reasons that we might do a rhinoplasty? Some of the indications are for cosmetic issues or concerns, congenital deformity, an acquired deformity like trauma, as in this patient in the top picture here, or trauma and previous surgery as for this patient who had collapse of his nose here. It also can address other issues, including breathing problems. And so a lot of times people will have a lot of difficulty deciding when is the right time for me to do this surgery. And so there are some common themes typically. And so graduation is one big one, whether it's from high school or college or grad school. Just a time of transition is usually a good time for people to make the leap and proceed with the rhinoplasty. Sometimes people are in between jobs and it's a good time because they have some time off to recover. And maternity leave actually ends up being a pretty popular time because people are off, they're about to go back to work and can fit it in toward the tail end of their maternity leave. And then also stage in life. Sometimes people have always wanted to do it and finally it makes sense financially and they have the time and the money to proceed. Also, some people have considered it for a long time and they decide, it's finally time, or they're getting married and they're concerned about the engagement photos, wedding photos, and maybe there's a reunion coming up. So there's a variety of different things that really make people take the leap and start looking into options. And so what do people want? They really want to look like themselves typically, but maybe a better version of themselves. They want to be recognizable. And, these are two quotes that we see often. Some people say, I want to see the difference, but I don't want others to know. And then there are other people like, I don't care who knows. I just really want to look different, but natural, because they've always been concerned with their nose. And so some of the concerns, some people are concerned about a hump or a bump on the bridge of their nose. Some people, the nose is too flat and they want the bridge built up. There are others where the tip is too wide or it's too pointy, it sticks out too far, it doesn't stick out far enough. The nostrils are too wide or the nose is too wide overall. Sometimes it's droopy and it becomes more droopy when they start smiling. And then asymmetry is also a big problem where crooked nose deformity, like the patient you saw in the previous slide. And so this is Tony. She's our lovely front office manager. And so she's the person that will greet you when you come into the office. She's the person that also answers the phone. And she will get you straight over to our patient coordinators, Kelly and Kat, where they will ask you about your goals, what to expect, and kind of give you some information about what to expect at the time of surgery. They'll give you some ballpark pricing and discuss timing that's based on your lifestyle and what you have going on. And then if you two decide that it's a fit, they'll get you on the books and schedule you for a consultation. If you are in a rush, like say you want surgery in the next 2 to 3 months, sometimes we have to start with a virtual consultation if you're in the area, with the examination to follow in the office. And then for patients that have had previous surgery, it's nice if you can bring the operative report with you. So when you come in for your consultation, I'll go over what your concerns are. We'll go over your medical history, any surgeries you've had in the past, any medications that you take, and any allergies that you might have. Some people have tape allergies, which does impact the actual surgical plan. And then we'll go over your social history. So sports and athletics do impact how you're going to heal and things that you have to keep in mind when you're in the healing phase and even beyond that, because you don't want to injure your nose after you've gone through all of this. Employment, a lot of people are still working from home, but if they're working in person, how long do you need to take off? So we talk about those type of things. And then some people have responsibilities, either taking care of a parent or their children, and they need to be able to know exactly what's going to be required of them after the surgery. So we review those things as well. People that smoke, we ask them to stop smoking, including marijuana, because we do know that that affects the healing process. Drugs as well. It'd be nice not to be using drugs in general and around the time of surgery. And then pregnancy and breastfeeding, we talk with patients and they coordinate with their OBGYN and pediatrician with regard to timing of the surgery. And then during the consultation, I'll also examine you. And so I look at the thickness of the skin, the structure of the bone, any cartilage issues, look at the inside of your nose, in particular the septum, which is that part that separates the two sides of your nose. The turbinates are these little things that can give some resistance to breathing, and then look at the valves. And so those things are important, not only for people that cannot breathe, but also for patients that can breathe, because we want to make sure we preserve your breathing during the surgical process. And then we will review the photos. And so the photos are morphed on the computer. It's not my favorite part of the process, but we can morph them and we can discuss what you like, what you don't like. And this really just a means for having a discussion and you kind of giving me some direction as to what you like. And then I can tell you if that's even going to work out. And if you would be able to breathe through a nose that you choose. So we also will save those pictures that we morph for the day of surgery. And I actually do like inspiration photos because it gives me an idea of what you consider to be a good result. And then you'll get to meet with the patient coordinators. This is Kelly, who's on the call here, and they will go over the quote for the surgery, which is an all-inclusive quote, includes all of your post-op follow-up and your recovery items that you'll need. The only thing it does not include are the prescriptions. They'll give you a consent form that you can take home and review, so that way when you come back for your pre-op, you've looked it over and you're ready to sign the consent form, we pick out a date that you're going to have the surgery and you place a deposit at that time, as well as scheduling your pre-op visit and post-op visits. The preoperative visit is 2 weeks before surgery. You're seen in the office to review the plan for the surgery. We'll go over the preoperative evaluation that was done by your primary care doctor, and that needs to be done within a month of the surgery. We'll review the consent forms, sign those forms, review the photos that we had morphed previously, and you'll get your postoperative bag to take home. And it's also good, I will send in your prescriptions that day and you can go pick up the prescriptions prior to the surgery so you have them ready to go after surgery. Out of town patients, I usually see the day prior to surgery if they're unable to come in for the pre-op visit beforehand. And then I know we have a lot of patients that are on this call that are from out of town. We have a lot of patients that will fly in or drive in. And there's a lot of local hotels down the street. The Marriott headquarters is within walking distance from our office. But patients will typically stay in town for the week or they'll get an Airbnb or something of that nature. We're very close to Washington, D.C., so if you feel up to it, you can maybe do a little sightseeing during that week. And there's also some nursing options if you're traveling alone. On the day of surgery, you get to the surgery center, we'll do the intake with the nurse. You'll also meet the anesthesiologist and they'll go over everything with you with the plan for surgery. And we'll also sign another consent form at the surgery center. Then you'll come to the operating room, and this is me in the operating room with the scrub tech and all of the instruments that I use to do the surgery. It'll be under general anesthesia. The surgery lasts anywhere from 1 to 3 hours, depending on what needs to be done. And sometimes I'll even add in like a chin implant if that's necessary, or upper eyelid surgery if people desire that. But there's a variety of things that we can do at the same time as the rhinoplasty. And then you will recover in the recovery room for an hour, and then you're driven home by a family friend or just family member or a hired nurse. You cannot go home in an Uber. Early post-op, the evening of surgery, you're going to sit up as much as possible, sleep with your head elevated. You'll have a little pad under your nose that you'll change as often as needed, and you'll eat what you feel up to eating. Then the next day you come back to the office, we'll remove the packing. Your incisions are clean. You can see this is the incision that's closed here. We'll go over the instructions again, what you're supposed to do for the next week, and then you'll just go home and relax, but stay mobile. So then you come back 1 week later, we'll get the cast off. And this is a patient, she was so excited to get the cast off. You can see she's got a lot of swelling going on here, but you know, she doesn't look that bad. She was able to put on some makeup and go to work. And you know, felt very comfortable doing that. Sometimes I will retape the tip a little bit to just prevent a lot of swelling in the immediate post-op period, but after that, there's no care that's needed. And so what's next? You'll continue healing for a year. The swelling will kind of go up and down over the course of the year, and that's really based on your activity level, the climate that you're in, it just really, and the thickness of your skin. There's a lot of different things that factor in. You'll resume vigorous exercise 3 to 4 weeks after surgery. And then here are some patients before and after. So this is a patient who had a very crooked nose. Now it's nice and straight and she's able to breathe through her nose. Another patient that had trauma to her nose and her nose was very crooked too, but wanted this like sign of trauma that she had to be taken away. Another patient that I've known for a while, she came in as a teenager and then felt like she really wasn't ready yet for surgery. And then she came back later while she was in college, and we were able to do the rhinoplasty and, you know, basically take down the hump, elevate the tip a little bit. She liked the tip overall. We just made it a little bit smaller. Another patient from out of town, she had a little hump, took it down, no incision here. She just wanted that hump taken down. Another patient that just wanted the hump taken down, lifted the tip a little bit, so that she's able to not see, those signs of her nose. She felt like it was big. This patient didn't like her nose most of her life and just wanted it nice and straight and some refinement of the tip. Another patient, same thing, getting ready for her wedding, really wanted this gone and accomplished that. Another patient, crooked nose and had a little hump there, wanted it straight. And this is about a month after surgery, healing well. And this is the reconstructive case that I showed you earlier, had a saddle nose deformity where there was some collapse here. So I was able to build up his nose using some cartilage so that it's nice and straight and he's able to breathe. So I would say some of the benefits of having surgery with me are that the results are pretty reliable. The fees include a postoperative bag with all the supplies, postoperative appointments, postoperative fresh face membership, which I'll talk about in a second, and discounts on all in-office treatments for that year. And so the fresh face membership allows you to come back and have treatments that are not really related to the rhinoplasty, but they are treatments that we do here in our office. So this is our lovely nurse, Megan, who does a lot of those treatments. So with that, I will end and we will see if there are any questions that anyone has. You're on mute. Hang on.
There we go. Sorry about
Okay.
that. For anybody who has any questions, please submit them in the Q&A box at the bottom. And I can go ahead and start asking some of these questions. Somebody wants to know what makes them a good candidate for a rhinoplasty?
Um, well, reasonable expectations, definitely. You want to, come in knowing that you don't like something about your nose and that you want it changed. And, understanding what's possible and feeling comfortable with what's possible are key factors. So I think the expectations are one of the biggest things to consider.
Right, there was another question about pain levels. Is it a painful procedure?
That really depends on the patient. I would say overall, most of my patients don't have very much pain. In fact, some people have said like their like cramps that they have during their periods hurt worse than the pain that they've had. Most people don't even take any of the pain medication afterwards. And I give Celebrex, which is an arthritis medication. And I would say most people are very comfortable with that, or they'll just take Tylenol.
For patients that do have some breathing difficulty, is insurance accepted?
So we don't accept insurance, but we do provide the codes that you would need to give to your insurance carrier. Um, I used to take insurance a long time ago when I started 25 years ago, and um, at that time it was, it was very difficult to get any money back from the insurance company. But I do think they're a little bit more cut and dry these days. And if you have a date for the surgery and the surgery's posted and you've submitted your information, they can give you some consideration as to what they would actually pay for it, hopefully ahead of time, and stick to that answer.
All right, and then there was another question about what is the percentage of patients that you treat that have breathing issues, like a deviated septum?
Mm. I would say it's probably about 40%. I feel like, I don't know, some months I feel like it's everybody. But then there might be a week where everybody's all cosmetic. So, but it's probably on the order of 40% all in all.
How soon after the surgery can patients fly?
We have a lot of patients that fly that day to go home. I recommend leaving the next day. But we have people that have flown to California, out of the country. So, and they've not complained at all, once we've talked to them when they've gotten home. So, people are typically fine. And I do some things during the surgery to help facilitate quicker healing so that people aren't so swollen, so stuffed up, so puffy, and are able to fly. And a lot of times what we'll do is tape the nose prior to the flight so that they're not getting too swollen on the flight.
Okay, it looks like there
Probably
was
could take like a couple more questions. Go ahead.
it looks like there was a question about scarring and if the scar is noticeable after you have a rhinoplasty.
I think the scar heals very well. Some people forget that they had a scar. Um, I've only seen one keloid on a scar, and that was a picture that someone had shown me of someone that had had like 6 rhinoplasties and infections, and there was something else going on. But overall, I think the scars heal very well, and I've not had any problems.
Can you touch base a little bit more on like an open versus a closed rhinoplasty?
Good question. So open rhinoplasty is where you make an incision on the outside. A closed rhinoplasty is all the incisions are on the inside of the nose. So, and that can address like the hump. You can do a little bit of tip work that way. For the open procedures, a lot of people end up needing that, and that's for a variety of reasons. So, a crooked nose, very often I will do open. Um, Breathing problems and the crooked nose, definitely going to do open. Um, Patients that want their tip lifted or elevated, or they want their nose not to move when they're smiling, definitely needs to be done open in order to secure the tip and make sure, like when they're smiling or stationary, their nose is going to look the same regardless.
Perfect.
And either way, a lot of people ask, well, is it going to heal quicker if it's closed versus open? In the end, they get to the same point about a month out. So it's a little bit quicker on the front end, but once you get to about a month, you're on the same trajectory.
Yeah. Perfect. And then we did have a question about finance options, which I can definitely touch on that really quickly. We do accept care credit. We do work with 6 months deferred or no interest for that. And then so once you have your consultation, we do give you your quote there. And if you wanted to schedule a surgery, it's a 20% deposit. And then at 2 weeks before is when we collect the remaining balance. So we would definitely show you everything broken down, including the doctor's fees, OR fees, and anesthesia fees as well. Great.
All right. Are the scars from open surgery visible without makeup? I would say if you're looking for it, you could probably see it.
Mhm.
But sometimes you need a little magnification.
Yeah,
So
they definitely hide nicely.
yeah,
Like people
it's
don't
not it's
usually
not an
know.
issue. So, and I would not let that sway you one way or another as to the approach for the surgery, because really you want to focus on the result that you want. And so,
Mhm.
if I examine you and I'm like, I think we should do it open, we should do it open. Or if I examine you and it's like, it looks like we could do it closed, I think, um, it's a discussion and I'm willing to listen to people's desires.
And then what are the
Anything
most
else?
common issues or complications patients would experience?
Issues. So definitely a little stuffiness after surgery. Um, Key thing is to use the saline spray that we give you, because that really helps to keep things clear on the inside. Swelling, I think, in the tip in particular is something that people are typically concerned with. And how quickly it goes down really depends on the person. For some people, it goes down very quickly. For others, it can take that full year and sometimes even longer. And I have some patients, I see them back, for a variety of things at like a year, 2 years, 3 years, 5 years. And you can see their nose is still in transition and looking better and better as time goes on. So, um, it's tough for some people, but it just really depends on the person. And I think they have to look back at where they started to see how far they've come. But those are the typical things that people call about, right? What did you say, guys?
Yeah,
They get all the
definitely.
calls. So,
Yeah,
and then they
definitely
tell
just
me
need to
about
be
it.
patient with the healing process. Just letting the swelling go down and, just let the healing process do its thing. Um,
Okay.
Perfect. Well, I
Well,
think that's what we
if,
have time for today. So I know a couple people did get a chance to have a private breakout session or do have a chance to meet with Dr. Porter. So if you do have that, you have the Zoom link. So we'll go ahead and switch over to Zoom. And we thank you everybody for joining us here for our webinar. And if you have
all right.
any other questions or want to schedule an actual consultation with Dr. Porter, feel free to call our office, or you can email me at kelly@chevychaseface.com, or Catherine is at pcc@chevychaseface.com.
Okay. All right.
Thank
Thank
you.
you. We will see some of you soon.